Look, I'll probably let you do the talking because it is a disease and everyone's been affected. That's on. Everyone's been affected by it. You know, I mean, and those who haven't would know someone who has been. It's one of those conditions. I mean, we saw Teddy Whitten going around this oval and through not being checked at a young age, you know, I mean, you know, he should still be with us today. But I'll leave it to you.
That's right. Well, as Reece mentioned, the chaps, you should start getting checkups. Now, 40 is Michael Jamison's number. I want you to remember that because 40 is now the age that you should get your checkups. You should be getting a blood test called prostate-specific antigen, which I might say is not a perfect test for cancer. What that test shows is that if you don't have a normal result, something is happening to your prostate. What we have to do is find out if that is prostate cancer or not. The doctor will also examine you, and you've all heard about it. Gents, by the time you're 40, your female partners have had 20 smear tests. Get over it. Okay? You're going to need the checkups from 40, they've had checkups from 20, and they probably had babies and bigger and magnificent things coming out of them than going into them. But do something about getting your checkups. Now, Reece said 1 in 9 men. It's actually coming down. 1 in 5 men in this room will be diagnosed with prostate cancer before they die. It does not mean that they will die from prostate cancer. There are lots of treatments available. As doctors and as people, you all want to live for a long time and a good time, and the treatments should not be worse than the disease.
Hopefully.
And that's what we endeavour to help people live for the long time and the good time.
I'll let you know.
And the treatments are always tailored to the individual, and it may be that someone's dead scared of surgery, well there's an alternative to surgery. Someone may be dead scared of radiation therapy, well there's an alternative to radiation therapy. Some people may not want anything major done. Well, we have less invasive procedures. One of the procedures that I do is called cryotherapy, which is freezing the prostate. And now I'm not advertising, I'm simply informing. It's one of those procedures where it's done as day surgery. It's about an hour and a half's operation. You're in and out the same day, and hopefully your prostate is destroyed by freezing, a bit like when you treat the sunspots on the skin. There are a lot of men who are very worried about getting treated or getting diagnosed because then they worry that, oh look, if I've got it, people want to do things to me. Not necessarily. It's very much an individual treatment. But if, gents, if you don't care whether you've got prostate cancer or whether you die from it, your sons have got double the chance of getting prostate cancer if you've got it. If your father's had it,
I was just going to mention that because I mean I know some mates who you know it's in their genes, but not in their genes, but it is.
I hope they keep it.
I don't work out what I'm saying here, but obviously it's hereditary, and so they get checked regularly. But you know, I mean, people such as myself, I mean, because it's not hereditary or whatever, don't get checked as often. Is that a failure on our part? I mean, who can get it, and is it just open to anyone?
Anyone can get it. It's more common in certain people than others, but particularly if relatives have a prostate cancer, then the chance of a man having it is going to be much greater than, or it's going to be double the chance if you've got one relative, 4 times with 2 relatives, 8 times with 3 relatives, and you really should get a checkup. I'm waffling on a bit now. I think it's probably time to get on with eating, isn't it?
That's all right. It's a very important subject, and we're glad you come along, and welcome down from Cairns, and hope you're down at the footy a lot more this year. Well done, Neil. Thank you very much.